So now we're going to go over how to do a hip flexor wrap. So this is if an athlete has a hip flexor strain or a pull up high in the thigh, okay? So this wrap is going to be very similar to a groin wrap. There's just a few differences. Same position, the patient's in front of you, slight bent knee, weight forward, their heel is up on a heel lift of some sort. It helps their muscles to contract and prevent cutting off circulation. One of the differences, their knee is now straight neutral ahead of you. It's not internally rotated, okay? So for a hip flexor, it's straight, okay? And then also, unlike the groin wrap, instead of pulling in, we pull out now, okay? So same thing, I start in the middle of the thigh, I come around. Always remember, have your patient flex their muscles as you apply this so you don't cut off circulation, okay? So I come around twice, I work up into the thigh, and then I come up around the lower stomach here, and I go around. Once again, the key is twice. You always go around twice, not once. If you go around one time only, this will slide down. If you go around twice, it won't slide down nearly as easily. Then come back underneath. I aim for basically right under the fold of the butt, okay? I come in high, and then I finish by working my way, spiraling my way down about 50-50 from the previous strip, all the way near the bottom of the thigh. And then once I reach near the bottom of the thigh, you don't got to go all the way to the kneecap or anything. Then I start spiraling again upwards. I always like to finish spiraling towards the heart. It's just something that I've always been taught. Not too tight, not too loose. Wherever you end, have the patient hold it. So he's going to pin that, or you're going to use the other hand. There we go. You're going to grab your tape. You're going to come around. You're going to create the little flag. Give yourself some slack. Make a pinch. Come around. And you're going to do about 2 or 3 of these. Okay. You'll get used to these pinches. They get easier and easier to make. Remember, the pinch is so that as they go and practice and their muscles inflame and get bigger, that flag can come undone without the entire ace wrap coming off. And if you didn't have that pinch in there and the ace wrap expanded under the white tape, it would compress into it and you could actually cut off circulation. Okay, so this is the hip flexor wrap, not the groin wrap, the hip flexor wrap, and what it will do is help aid with hip flexion, okay? So it will help prevent hip extension, okay? That way they don't tear further into the hip flexor.